So today we are discussing about wisdom tooth review, how to check the patient, what all to check when we are doing the consultation for the wisdom tooth. So I am going one point by point in this form, which is a wisdom tooth assessment form available in our clinic. So first we check, address the patient by their name, because everybody likes to listen to their name when they are spoken to. Identify the age, whether it's a young individual, old individual, because the treatment quality, treatment standards are going to be slightly different. We have to make sure about controlling the anxiety of the patients. We have to interact with them in a certain way based on their age. We have to pass on some references, judgments and examples based on the patient's age and their background. Then the first thing which we want to address is the medical history. So always review the medical history, no matter how young, old or middle aged the patient is. If it's a young female, always ask for pregnancy. It's not an embarrassing question anymore. Always ask about tobacco and alcohol history in the same. It's not embarrassing, or it's not judgmental to ask these questions. This is required for our proper treatment planning. And in case the patient is having some medical history like a kidney disease or a liver disease or diabetes, hypertension, thyroid, then you can send the patient for a physician consent to their respective physician. Make sure that it is a MD or a MS physician, not a BAMS or just an MBBS, because those physician consents which are given by MD or MS are only valid in the court in case something happens. So make sure that you send the patient to an MD physician. Near our clinic we have very good MD physician, Dr. Asmita Deshmukh, and we have Dr. Bharat Agarwal. For both these people you can ask for the medical physician. Both are MDs and they are diabetology specialists. And then once you understand what the medical illness is, based on that you should give the first based on that you should give the first medication to the patient. So if the patient is having any allergies to penicillin, obviously avoid augmentin, avoid amoxicillin, avoid any kind of cephalosporin or penicillin containing drugs. In case the patient has allergy to amoxicillin or penicillin group of drugs, you can give azithromycin, which is a macrolide. So that AZ 500 mg once a day for 5 days works very well for these kind of patients. In case the patient is having any kidney disease or liver disease where the biotransformation of the drugs like NSAIDs is going to create some problems in the system, then it is better to give Lanol ER, which is a extended release paracetamol for pain relief. It works very well for patients having kidney or liver disease or who are not tolerant to the NSAIDs, like gastric issues if the patient has. So you should avoid NSAIDs like Zerodol, avoid ketorol. Definitely can give Lanol ER on SOS basis or 3 times a day. You can also give Dolo 650. Don't give Crocin. Crocin is only a 500 mg. 500 mg paracetamol does not work well on pain. It only works on the fever part. It is an antipyretic basically. Also you can give Ultraset, which is containing tramadol along with the paracetamol. So 37.5 mg tramadol along with 325 mg paracetamol, that works very well. It is Ultraset or Argendol, both the brand names are available. You can give up to 3 times a day for pain relief. Then if the patient is having any, we have to check whether the TMJs are normal or abnormal, because in these patients after doing the wisdom tooth removal there is high chances that if the patient's TMJ is abnormal from the start and or the muscles are already sore, then the patient may develop some click, some tenderness over the joint, some headaches, or even complain of muscle spasm and muscular pain, which will mimic as a tooth pain or pain around the extraction socket. So those pains are to be differentiated. So if always check, examine the TMJ and the muscles in case of a wisdom tooth procedure, before the wisdom tooth procedure, and inform the patient, because anything which we inform before the procedure is examination, is advice, is a suggestion, but anything we inform after the procedure looks like a justification. So make sure that we touch upon that point, that your muscles are little sore, your TMJ is slightly abnormal, and that can create a problem after the wisdom tooth removal is done, and we should inform the patient accordingly. Then also check for muscle spasm. If the spasm is severe, you can add on a Flexon MR or Myospas Fort, which is a muscle relaxant post surgery in the night HS, so that the patient's muscles are not inflamed after the procedure. Anyhow, in the procedure, the muscles are going to get slightly tortuous spasm because of anxiety, because of the injection, because of applying pressure in the TMJ area. It can get slightly aggravated, so always inform the patient that this is a possibility and we can manage it in due course of time. Then check whether mouth opening is adequate or inadequate. If it is inadequate, then complexity level increases further. Check, in fact you can check by putting the burr in the handpiece and checking whether that handpiece head is actually going inside till the end of the mouth, whether you are able to section the tooth if it is required based on the x-ray, and how will you position the elevator. If it's a very small mouth, there can be lip chaffing. The lip can get severed because of the elevator use in the distal area of the mouth, because we have to push the elevator quite behind, and these things should always be defined beforehand, and we should then tell the patient to take precautions. Then check risk factors for healing. So risk factors for healing are smoking, especially smoking, which creates a lot of dry socket and delays the healing. Diabetes, again, if there is diabetes, always check the diabetes levels. If there is a bone disease like parathyroid hormone, vitamin D deficiency, again that will reduce the healing capacity of the bone. Check for calcium levels, check for vitamin D levels, check for occlusion, because if there are occlusion facets, if there is trauma from occlusion on the third molar, sometimes trauma from occlusion causes mobility, so it will be easier for you to remove the tooth. Sometimes trauma from occlusion causes condensing osteitis and hypercementosis also, in which case the root's end will be swollen and it will cause difficulty in removal. So there we may have to cut the and section the roots and the tooth and remove them properly. Also check for periodontitis, and whenever we are doing any surgery, make sure that area is very clean. So once the LA is given, always scale that quadrant. Like if we are removing 3/8, so always scale 3/6, 3/7 and 3/8 thoroughly, and then only reflect the flap. Otherwise some pieces of calculus can get stuck in the flap, and then again it can cause problems in the healing. Then we have the sixth point, which is the relation to the nerve, which is very important and significant factor for the patient. So there are levels to check how that nerve is related. In an OPG, if you are seeing a darkened root end, if you are seeing a curvature in the root, if you are seeing any disruption in the cortical border of the infra-alveolar canal, then always refer for a CBCT. In the CBCT, we will be actually able to check what is the closeness of the root to the nerve, and you can inform the patient in a manner which is quite comfortable for them to listen, that around 1 in 1000 or 2 in 1000 patients have this condition where the nerve is very close to the root. We are actually not going to drill in the nerve, we are not going to cut the nerve, we are not going to do anything near the nerve. Whatever we do is actually from the top area only, which is much further away from the nerve. But when we are putting pressure to remove the tooth, when we are moving the tooth in the socket and we are taking it out, that time if the root end is very close to the nerve, the root end itself gives pressure in some areas to the nerve, and that can create some partial loss of sensation in the lower part of the lip, which is sometimes temporarily and very rarely permanent. So the incidence is very rare. Temporary incidence, it stays from 6 weeks to 6 months, but permanent loss of sensation is extremely rare. So we should inform the patient in this word, so that the patient is well informed, and then we can start preoperative steroid also in case we feel that there is going to be post-surgical edema, a lot of bone cutting, and in case we feel that the nerve is very close to the root, always give pre-surgical steroid. So pre-surgical steroids can be given one in the morning, like we prescribe betamethasone, so 2 tablets of 0.5 mg betamethasone in the morning and 2 tablets in the night, continued for 3 days. We can also give Vizalon. So Vizalon, if given, it's a higher dose, about 5 mg or 10 mg per dose can be given for the first 3 days, and then in the next 3 days it can be reduced to 5 mg, and then next 3 days it can be reduced to even lesser, like 2.5 mg, so that the steroid is given in a tapering dose and it doesn't cause any ill effects in the system. Then we have the Pell and Gregory's classification for complexity of the wisdom tooth, where we can actually understand from the OPG what is the level of complexity of the wisdom tooth. So basically, if the wisdom tooth neck, if the occlusal level of the wisdom tooth is at the level of the second molar, then the complexity is not so much. But as it goes below, and the occlusal level of the wisdom tooth is like more closer to the CJ, if the tooth is lesser in height, it is more submerged and very close to the CJ or even below that, then the complexity level increases. This is the first thing. The second thing is we have to check how much bone is covering on the wisdom tooth. From the OPG we can get to know what is the internal or external oblique ridge which is covering on the wisdom tooth. So if the full distal surface is properly visible in the OPG, fully erupted, or in the mouth it is fully visible of the wisdom tooth, then it is an easier extraction. But if the wisdom tooth distal surface is quite hidden and there is soft tissue and bone covering on it, then it is more complex. So we have to inform the patient in that manner that what is the complexity level, is it very complex or is it easy. Don't scare the patient about it. Then we have to have a checklist. So the checklist is we have to take a photograph of the wisdom tooth area, we have to make them sign the consent when they come for the procedure, and we have to take an OPG and a CBCT if required, and we have to complete the case history properly. So that completes the discussion on the wisdom tooth assessment, how we do it at Ivory Dental Clinic. This covers majority of the points of wisdom teeth, and in case of any doubts you can reach me. Thank you.